Oh, you took your time.
Use the loo downstairs.
Yeah, I'll run up and down the stairs. Usain Bolt, that's me.
And don't forget you got the doctors in an hour.
I know.
And have you packed? Because you won't have time after when Tony gets here.
No.
I'll throw some things into a bag for you.
No, you won't. I'm not going.
Since when?
I telephoned Tony yesterday, cancelled.
And when were you thinking of telling me?
Well, making a difference to you, you weren't going.
Honestly, no one knew where to look.
You're joking.
She was absolutely mortified. I've never seen anyone go so red.
I can't believe that she thought that I would say anything.
Oh, come on, that is an easy mistake to make.
Beg your pardon?
Well, if you want to spread a secret, tell a woman. That goes double for you, love.
I'll have you know I am the soul of discretion after being my job. There are some things that I know about you that have not passed my lips. Scarborough, 1986.
Well, I better be off. Oh, you haven't forgotten you said you'd sort me out some work experience, have you?
No, I haven't. It's just been a bit tricky, that's all.
Dad, I need it as part of my module requirement.
All right, son, yeah. Leave it with me. I'll see what I can do.
What happened in Scarborough?
And he didn't think to tell me? Well, he didn't. Did he even say why he didn't want to go? Yes, he needs a reason. At the very least, Tony, you could have persuaded him for me. I get him every day. He's your father too, Tony. I just wanted this one weekend to myself. Well, it's important to me.
I know Elaine's a scarlet woman, but she might have done us a favour after all.
What do you mean?
Well, after a total hypocrisy, I'm sure we can agree that family therapy was a total sham.
The aerospace.
Because we sorted it out ourselves, didn't we? Anyway, it's all ancient history. We can go back to being a happy family again.
Come on, love, you're going to be late.
I was waiting for you. Bye, Dad.
Yeah, bye, love.
Did I interrupt a bit of father-daughter bonding time there?
You might have done. Bye.
Bye.
Oh, not wallpaper paste again. What's about some bacon and eggs?
You know what that does to your cholesterol level.
Once or twice, won't it, will it?
I'd have thought 2 heart attacks was enough for anyone to get the message.
Oh, been sleeping in the knife drawer again?
Well, what do you expect? Neither you or Tony show me any consideration.
Oh, you're not going on about that, are you?
I had plans.
What plans? You never go anywhere.
Do you not think a bit of sea air would do you good? And you haven't seen Tony since Easter.
I'd have to see his wife, though, wouldn't I? I don't know how he stands her. She hangs over me with a coaster and a wet wipe, daring me to make a mess. She lives in a show house, not a home. I know. Why don't we get a bottle of wine in and maybe get a film tonight?
Which you'll snore through.
Ah. Oh! Oh!
Dad!
It's only milk.
Leave it, I'll do it.
It's a stupid carton.
You better take your tablets.
I always take my tablets. I sometimes think I rattle when I walk. I don't even know what half of them do. What's this?
Cranberry juice. Lowers your cholesterol.
Oh.
If you're going to have a blood test today, it's just what you need.
Yeah. Oh.
Morning.
Morning, Karen. Morning, everyone.
Morning.
Hello.
How are we all today?
Good.
Oh, fine. Little just bored.
I better be...
Heston, I was thinking about you last night.
Really?
I was doing this wonderful stretch to be perfect for you. It eases all the tension in the lower back. In the Sanskrit, it's called the Uttanasana, but it's a simple forward bend.
I'll leave you to it.
Keeping your legs straight. Deep breath. Bend from the hips. Wonderful.
Yeah, it looks good. Thank you, Elaine. I've got a few calls to make before surgery. Do you mind if we reconvene a bit later?
Of course.
Sorry.
Do you think that me and Dad are okay now?
You seem to be getting on all right this morning.
We haven't really talked about what's happened.
Well, I'm sure he wants to put it behind him.
But I can't. Not yet. I know that I've let him down, but I want him to understand why.
Well, you know what he's like. He'll deal with it in his own time. It's a miracle we got him to come to these family therapy sessions anyway.
Yeah, but it's like 1 minute Elaine's done us a favour and the next minute it's a waste of time. I don't know where I stand with him.
I'm sure it's going to work itself out in the end. You know, you better get your skates on if you're going to catch that 9 o'clock.
Deep joy, Lauren, all morning.
Come in. Mr. Lindstrom, yes?
Yeah, Bill Lindstrom. I don't think I've seen you before.
I'm Dr. Tyler. Please, come in.
I'm Emily's daughter.
All right if she sits in. She makes sure I stay on top of my tablets.
Of course. There you go. Okay, so, how have you been? Any problems?
No, just muddling through, you know.
He's been waiting for a bypass forever. I don't suppose there's any way of hurrying it along.
It's only been a few months.
Waiting is the hardest part, I know, but I'm sure it'll come up soon.
He's been very breathless recently.
No more than usual.
Now, when have you noticed that?
Well, it's not too bad, really.
You were complaining about it this morning. You could hardly get up the stairs. He hasn't been sleeping either.
Don't put the mockers on me.
Okay, Bill, I'm going to do a thorough examination and we'll take it from there.
It's only me. I know you're on a half shift. I was just wondering, would you pick me up? She's stuck at campus all day. You could take her out for lunch, have a chat. Okay, thanks, love. Bye.
Your blood pressure seems a little low.
Is that serious?
Given Bill's history, that might actually be a good thing, but I'd like to keep a check on it.
Is that in hospital for further tests?
I'm not going back in there.
No, we'd just like to see you in a week's time.
But shouldn't he have some tests, just to be on the safe side?
Given your history, I think you're doing okay.
You hear that? Lindstrom, constitution of an ox.
Except when it comes to stairs.
Really, the worst thing you can do is worry. Now I'll get the nurse to take some blood and check your warfarin levels, okay?
You should have eaten breakfast.
Why, I would if it had been worth eating. How about a cup of tea?
Dad, I've got work.
Right, your high-powered job, I forgot.
I'll put the kettle on for you, and then I've got to go. You get yourself something to eat later.
You know I don't like using the stairs when I'm on my own.
And that was important to keep from the doctor, wasn't it? God forbid he should hurry your operation along.
I didn't want to bother him this morning. Anyway, I'm not sure that I even want to have it.
What do you mean? Of course you'll have it.
Well, I don't know. I'm going to have a little lie down.
How are you getting on?
Getting there.
Do you think you'll be finished by lunch?
I don't know about that, there's loads.
Maybe you should stay on until you're finished then. You're not back at school yet, are you?
All right, lovely ladies.
Perfect timing. I just put the kettle on.
What are you two up to then?
I was just giving Imogen some image advice.
Excuse me?
Well, you've got to admit, no one's going to take you seriously with that hair.
Well, she's a student, isn't she?
She's an admin assistant. She deals with the public. Patients have been making comments.
Really?
Hello, I am in the room, you know.
Look, the way I see it is, people judge you by your appearance, yeah?
Sad but true.
Well, you look good, you look smart. People respect that. They respect you. Like me and Dr. Tyler here.
Oh, cheers.
Whereas you...
What?
Let's put it this way. If the circus came to town, they'd offer you a job like a shot.
That's a bit harsh. I think you look striking.
Coco the clown striking. I'll bring your coffee through.
So?
Oh, thank you. I'm not hungry.
No, but you might be later. What do you mean about not wanting your operation? Dad, you know that's not an option. Dad!
It's a big thing. It's risky. I'm not sure I'm up to it.
We've been over this. Without it, you won't get better. Look, I've got to go. We'll talk about it later.
Yes. Have a good day.
I want to see you take your tablets before I go. Otherwise, you'll forget.
I won't.
Dad, you always forget.
That is too sour.
But good for you. Now take them.
Ugh, yuck. Happy now? Oh!
Do you have any plans for lunch? My treat.
Well, that's very kind of you, but
Good.
I can't.
Oh,
I'm sorry. I've got to rush into town and pick up my cleaning. So, anyway, I'll see you later.
I was wondering if you got a minute.
yes.
I need a second opinion on a patient.
Of course.
He's presenting conflicting symptoms, and I was just wondering what you...
Wilson, phone!
I get that. I'm sorry.
Dad, what are you doing here?
I just thought I'd see if you wanted a lift home or if you weren't doing anything. You fancied a pint?
A pint?
A drink, whatever.
What, you and me? In a pub?
Yeah, okay, fair enough. Silly idea.
No, I'd love to. Can I have a pint?
You can have one.
Lincoln House? Yes, I'll just put you through. Are you all right?
I can't find the TV remote.
Dad, I told you should only call me at work if it's urgent.
It is urgent. I want to watch the news.
Well, I've no idea where it is. You can go straight through, Mrs. Atkinson.
Why do you always move things?
I don't. It'll be wherever you left it. Now I've got to go.
Oh, and where are the indigestion tablets?
Why do you need those? Are you having chest pains?
I know the difference between wind and a heart attack. Oh!
What's the matter, Dad?
Panic over. I've found it.
Caught you.
There's no harm in looking.
Is that all you can do?
Well, I'm more of a hands-on kind of guy.
Aren't you a dark horse?
Oh, there's more to me than meets the eye.
Is that right, Dr. Tyler?
Oh, yes. Ambitious, dynamic, thrusting.
Thrusting? Do you really think that kind of thing works with the ladies?
Look, I know you're disappointed, and I was really looking forward to it. It's just... There'll be other weekends, I promise. I'm sorry.
I'm sorry too.
I said I'm sorry. I tried. I did everything I could. What now, Dad?
I've been sick.
Very much?
Emma, it's not just sick. There's blood.
What do you mean, blood?
Blood. Can you come home?
I'm coming now. Call that doctor we saw this morning.
No, I don't want to see a doctor. I want you to come home.
If you're ill, you need to see someone. Especially if you're bleeding.
I'm fine. It's probably an empty stomach.
Thanks.
So, back at college soon. You're looking forward to it? See all your mates?
They'll be at uni.
Oh, yeah. Of course, right.
Dad, you do know I'm sorry, don't you?
Yes, love, I do. And so am I. Maybe I should have handled it differently. But I do realise now that you were having trouble and... well, I shouldn't have thrown you out. I shouldn't have turned my back on you.
Thank you.
It's funny, it sort of got me thinking, what with everything and Elaine, thinking about my own dad.
Yeah, you never talk about him. What was he like?
Anyway, cheers.
Cheers.
Emma?
Yes, Dad. Straight up. Dr. Tyler's here too.
Oh, great.
Hello again.
No need for you to come out. Emma, what are you calling for?
She's obviously worried about you. You've been sick, I see.
Yeah.
That's serious, isn't it?
Probably looks a lot worse than it actually is.
It's probably just something I've eaten or not eaten. I mean, you said I should have had breakfast. Just what with all those tablets and everything.
Let's examine you and find out. Would you mind opening your shirt?
Yeah. There you go. Oh!
Hurts there.
Bit tender.
Do you think he needs to be in hospital?
Let's see.
I'm not going to hospital, that's final.
I'll be downstairs.
You obviously haven't felt very hungry.
Oh, well, my stomach felt a bit odd after I've been to see you this morning. I should have had something to eat, shouldn't I? Oh! Oh!
I've always wondered what he was like. Auntie Ag said that once when you were a little boy. He told you he was taking you to the football, but then he took you to the dog track.
Yeah, that's true. He gambled away a whole week's wages. He got drunk and he left me. He wasn't a very nice man, love.
I don't blame you for what happened. I deserved most of it. And now I realise how lucky I am.
Yeah?
Yeah. Doing community service, you meet all sorts of people. And for some of them, life really is bad. There's this one girl, Jade. She says that her dad gets drunk most weekends and hits her mom, but recently he started beating on her as well.
Yeah, well, there are a lot of families like that.
Well, it got me thinking. Maybe my dad isn't perfect, but he's not that bad after all.
I'll take that as a compliment.
How is he?
I think it might be an ulcer, but I'd like to get him into hospital for some tests.
Yes. Yes, if you think that's best. How long do you think he'll be in?
I don't know, a couple of days, maybe.
Well, where are my manners? Can I get you a cup of tea?
Yes, thank you.
Bit out of practice. Don't often get visitors. Certainly not dashing young men riding to my rescue.
So it's just you and your dad here?
Yes, since my mother died. I came back to nurse her through cancer, and then Dad got ill, and here I am 4 years later. Feels like a prison now. Milk?
Please. The tray Bill had at lunchtime is still here?
No, I've washed it up. Why?
Well, the cranberry juice, I thought I saw some upstairs.
No, that was mine.
Well, I better get back to Bill.
Of course.
Hello? Is anyone there? Yes, come in. I'm just,
Oh, I'm so sorry. Are you in the middle of a downward dog?
No, it's fine. How can I help? Oh, the patient diagnosis this morning.
Oh, that. No, he's fine. That was actually an excuse. I wanted you to feel...
Needed? Less of a pariah?
No. Well, yes. But people can be so intolerant of a woman expressing herself sexually.
Right, I suppose they can.
I mean, if you'd been Kevin, perish the thought, it would have all been Jack the lad and good on you, son. But because you're a woman, then people automatically brand you as a
whore?
No.
Marriage wrecker?
No. Look, I am obviously saying all of the wrong things. I just wanted to be supportive, Elaine.
Thank you. It's nice to know. But I don't know you very well, and I'm finding this humiliatingly personal.
But there is someone that you can talk to.
Yes, I think so. But thank you.
Any time. It's a lovely smell, by the way. It's very woody.
Yes, it was absolutely disgusting.
Drinking cranberry juice whilst you're on warfarin may increase the drug's effectiveness, which is thinning the blood, so it's possible that in extreme cases it may cause bleeding.
How bad?
Let's just get you into the hospital and checked over.
But it's good for him. You said yourself that his blood pressure was low this morning.
It was probably low because Bill was bleeding. That states very clearly in the information leaflet that comes with the medication that you shouldn't be drinking cranberry juice. But you know that, don't you?
No, she wouldn't have given it to me if she'd known. She's excellent with my tablets and everything.
Do you know how serious it could be?
I just wanted a break. Just a couple of days.
What? You did all this because I wouldn't go to Tony's? You could have killed me.
I didn't want that.
I'm gonna call an ambulance.
I just thought if you went into hospital it would give me a break. My whole life revolves around you. I haven't been on holiday in I don't know how long.
Well, we went to Lyme Regis last August.
That was not a holiday. After I pushed you up and down that hill, I was more worn out than when we left. You don't help me, Dad. I'm expected to wait on you hand and foot and I can't do it anymore.
Well, I'm sorry to be such a burden.
But you don't have to be. You can do so much more for yourself.
What? I get puffed brushing my teeth. And I don't know when I'm going to peg out. It could be
You won't take your tablets unless I make you. And I couldn't believe it this morning when you said you weren't even sure if you wanted your operation.
It's a big decision.
No, it isn't. Honestly, Dad, it's as if you're afraid of getting better or something.
I don't want to be alone.
What?
If I have this op and you leave me, I can't live alone, Emma. I don't want to be like this. I hate this. Oh!
Dad!
Oh!
Dr. Tyler!
Hello. You had a nice time?
Yeah, great.
Didn't look like it was that great.
It was really nice of Dad to take me out and everything. He even apologised for being hard on me.
So why the long face?
I just would have liked to have talked things through a bit more.
Well, I think that's as good as it gets. Well, you've got a lot to concentrate on. You know, resits, working at the mill.
Actually, I've been wanting to talk to you about that. Lauren's being a real bitch.
She's not that bad.
Well, no, because she's little Miss Perfect in front of you.
Oh, Imogen, we've been through this. You can't always work with people that you like. This is the real world. You're really lucky to have the job that you've got. Do well, Julia, bound to write you a good reference, and you know how valuable that's going to be.
She criticises me all the time.
Just ignore her. Get your head down. Do your work well, all right?
What did they say?
Paramedics also suspect a gastrointestinal hemorrhage.
Is he going to be all right?
If we've caught it in time, yeah.
If you'd just done something this morning when we came to see you, this would never have happened.
You what?
You're a trainee, aren't you?
No, don't you even
Maybe
dare
we should
go
see
there.
someone else, a proper doctor.
And exactly how am I responsible for you abusing your own father?
Abuse?
How else do you want to describe it?
I didn't mean to abuse him.
Yes, you did. You knew the rules on warfarin and you deliberately made him drink that stuff.
You have no idea what it's been like.
No, actually, I do. I was brought up by a single mother, and yeah, we got on each other's nerves, but it didn't end in grievous bodily harm.
That's not fair.
Life's not fair. He's your flesh and blood. Yet you're treating him like some old dog that just gets in your way. Oh, poor me, I can't cope. I've seen people in their 80s who look after their families far better than you. Kids with better sense of responsibility, but you can't cope. You're pathetic.
I suppose you'll get your weekend break after all. When I come back from the hospital, will you still be here?
Where else am I going to go?
Oh, was that so bad?
Let's talk about it later. Just let them get you seen to. Will you have to take this further?
Of course, your father's sick. Very sick, quite possibly as a result of your deliberate actions. Been making a report to my supervisor and to the surgery partners, and it might be referred to the police if your father wants to take it further. I'm sorry, but I can't just ignore this. As a trainee, I have to do things by the book. Goodbye, Miss Lindstrom.
Hello?
You all right, Dad?
Yeah, good day at uni.
Yeah. Do you have any luck sorting out that work experience?
Actually, I did, yes. I've got you a day shadowing Senior Forensic Investigator Dr. Keller.
Isn't he the one who's with Dr. Cassidy?
He wasn't my first choice, but you're in no position to be fussy, are you, son?
It's going to be a bit awkward, isn't he?
That's all I could get. Take it or leave it.
Great. I thought you'd get me something on the Murder Squad or Vice.
Come on, that was never going to happen, and you know it.
Morning, Dr. Keller. I've just met your heavily pregnant wife, the one you've been cheating on with our family therapist.
Oh, pack it in.
Heston,
Oh, Elaine, I'm just off.
did you have an opportunity to try that stretch I showed you this morning?
Not yet. I certainly will later. I must dash. Don't want to be late for rehearsals. Good night.
Good night.
I'm going to send the nurse round just to check.
Hi, Mum, it's Melanie. Look, I brought her some lunch.
What the hell is she doing here?
My salad dressing.
Don't.
What's that?
Get out.
What is that?
I said get out.
What in the name of...
What makes you think I'd want to go out with you?
Because you fancy me.
She's a junkie. We've been here before. You can't trust her.
Testing times for Kat when her